Echo webinar. We have Conrado Jimenez as well, an MS1 student. We have Nino Anakin. We got our coordinator here, Laura and Max. So thank you everyone for joining us today with Vicky or Victoria Fine. This is a very important webinar because our US distance learning training program is having an annual grant, and the grant is around 50,000, correct me if I'm wrong, Vicky, to 1 million. There are so many zeros on that, to eligible applicants. And the program application will end, is currently open and will end in January 30, 2023. So there's a little bit of a rush here, but better late than never. And eligible applicants include most entities that provide education or healthcare through telecommunication, including most states and local government entities, federally recognized tribes, nonprofits, or for-profit businesses and consortium eligible entities. All grants applications are vetted and accepted through a very competitive process. That's why we asked Vicky to be with us to help us in that, navigate that competitive process. Then I will hand it over to Conrado Jimenez to give us a little bit of a information about this educational activity.
Yes, so this educational activity is a project of TexLa Telehealth Resource Center, and it is a federally funded program with F. Mary Hall Rural and Community Health at TTU-HSC, as well as Well Ahead Louisiana, with a generous support from Health Resources and Services Administration, or HRSA. Also, make sure that, oh shoot, sorry, this is not my part. So is that it? Is that pretty much?
Yeah, just make sure everyone is muted and type in your questions if you have any comments in the chat box. And Dr. George here will now introduce our speaker.
Happy New Year, Victoria. Victoria Fine is a funding strategist with the Learning Design Apply, a grant consulting and management firm. Victoria joined LDA in 2020 and has focused on funding for telehealth, distance learning, and collaboration initiatives. Prior to the LDA, Victoria worked in client and project management at the number of technology startups in Los Angeles area. Outside of work, Victoria enjoys searching for the next good meal and cheering up her favorite basketball team, the Dallas Mavericks. She holds a BA with honors in psychology from the University of Chicago. Take it away, Victoria. And thank you for again being part of our first Project Echo for this year, 2023.
Awesome. Thank you so much. That was such an awesome intro as well. And it's great to be on with some individuals from Texas as well, because I'm from Los Angeles. And when I say that I love the Dallas Mavericks, nobody understands that here. So really exciting. Anyway, I'll get going with the presentation today. Just before we get into it, as we already said, this grant is currently accepting applications. We're going to go through a lot of details on this program today, but keep in mind the deadline is coming up for this cycle very, very quickly. It'll be due in just a little bit under 4 weeks on January 30th. But the thing is, this is a recurring program. It typically comes out every year, actually usually not quite around the holidays. It usually comes out more in the spring or so. So if this year's cycle is just a little bit too quick for you all to put together an application, I think it's great to know about this program. This program doesn't change very much from year to year. It's a very long-standing program, so always something that you can look at in the future. A quick agenda for today. I'm just gonna do a little introduction to our organization, Learn, Design, Apply, and then sort of give you a funding 101 kind of funding overview, not just relevant to the RUST-DLT grant, just funding programs in general. Then we're going to spend some time doing a RUST-DLT overview, and then we're going to get into basically creating a competitive project. So how do you really set up a project that's going to maximize your score and be most likely to win this funding? And then there's 2 parts that go into that. There's an objective score, we'll talk about that, and then there's a subjective score, which is basically your narrative, which is talking about the communities that you're going to bring services to, and essentially why your project should be funded over other projects and how to really communicate that effectively. We won't have time to go through every single application component. There's quite a few, but there's a few that I want to highlight just little showstoppers that we see here and there, and things that we think are, good for you to take away out of this conversation. And we should have some time for Q&A, but I definitely encourage you all to put questions in the chat. We'll try to, I think, kind of answer those as we go through, if any questions align with what we're talking about, but some of them we might just try to save that until the end. Okay, so a really quick introduction to Learn, Design, Apply, which is the organization that I work for. We are a grant management and consulting firm, and we help a lot of organizations in healthcare, education, state and local government, nonprofits. We help tribal organizations and other similar groups pursue funding opportunities. We focus typically on federal funding opportunities. Those tend to be, some of the largest ones, the ones that are going to be applicable throughout the US, but we look at other funding as well. And the way that we typically work is we have partnerships in place with certain technology vendors, sometimes with broadband providers. We do a lot of broadband funding as well. And we basically have those partnerships, and we help the customers of those organizations pursue funding opportunities. But we can also potentially contract directly with a group that's looking to do a project. It just depends on the project, it depends on the grant. So we have a few different ways that we can work with groups and support groups. And as far as services that we offer, really just depends on what you're looking for. We do a whole bunch. We can help you find funding. We do a lot of education like this, and we can have a one-on-one discussion with you and just, let you know of what we know of that's on the radar that could maybe be a fit for you. We can, let you kind of go through the pre-qualification process. We can guide you through that. We want to make sure you're only after, going after grants that you're going to be competitive for, and we can help you figure that out. A funding strategy, that basically means, sometimes we have to look at multiple programs to help you get to where you're looking to get to, so we can assist with that. And then if you're looking to apply for something, we can help you throughout that process. Typically, we serve as a project management resource. We keep you on track with all the paperwork. We make sure that everything's getting done, and that, that application is just most likely to get funded once it's complete. We can also help you locate a grant writer. Typically, we do not write the grants for you, but we can help you locate a grant writer that knows that program really well. We also guide a lot of groups in writing the grants themselves. We help a lot of groups who've never written grants, and they're still able to do so and able to get funding. And then we can also help with some of the post-award, the implementation support. So once you're funded, the paperwork requirements, reimbursement requests, annual reporting, things like that. We could just help you get a handle on that. So let me move on now to a really quick funding overview. So I always like to start out with this. You might know about this already, but I think this is a really great way, if you're very new to funding, just a way for you to think about funding. So funding is rarely about the what. So with all funding programs, you're probably going to have some kind of budget you're putting together. You're going to have things that you're asking for, but programs are not usually focused on what you're getting. Programs are actually focused on how what you're getting is going to address a specific need. So what problem are you trying to solve? What challenge are you trying to solve? Programs can look at specific types of demographics, specific geographies, such as bringing services into rural communities, specific challenges, reasons challenges exist. Some programs are going to be more of a short-term fix. Some programs are going to be more of a long-term fix. So all of these things really matter when it comes to funding. And a lot of times when we start working with a group, we just have a discussion around, getting to know you and essentially what your focuses are, what your goals are, and that's how we help you find programs. And that's a similar exercise that we always encourage groups to do on their own is, what are we really trying to solve? IT might have their own needs, and then, other groups might have their own needs, but what is the overall kind of, big picture problem that we're looking to address here? Funding follows the problem. That's our big motto. And now I want to take you through just some general tips. First, tips for finding good grant programs. And then on the next slide, I'm going to have just some general tips for actually applying to grant programs. I won't go through all of this, but just to highlight a few. Make sure you sign up for funding announcements, but don't overwhelm yourself. So a lot of these agencies, they're going to have some way for you to sign up for alerts, and usually there's search terms that you can select. You'll notice right away if they're emailing you too much, so you might have to refine those search terms a bit, but that's a great thing to do. Is that way you can stay on top of programs that are coming out. What we recommend also is making a funding calendar. So essentially, these programs, a lot of programs recur, and start tracking the programs that seem like they're going to be relevant to you. So like this Rust DLT grant, like I said, if this year isn't right for you, if the timeline's a little too quick, again, just note the program, because if you bring services out into rural communities, this is going to be a great program for you to look at in the future. Usually you'll have a website for the program where you can look at previous awardees for that grant. We recommend doing that. Get a sense of their projects and what they did. Does this align with what you all are looking to do? And you can even contact some of those previous awardees for their input. For eligibility requirements, definitely make sure you look at those, but beyond just the application, make sure that you can actually, implement this program, and think about partners as well. So some programs require partnerships, especially in the healthcare space. Some programs won't, but oftentimes it's beneficial to have partners. But think about that, anytime you're working with someone external to you all, there's added complexity. So there's this balance of, adding partners where it adds value, but not adding so many that the project becomes overwhelming. And then if possible, try to gauge how competitive the funding is. So usually when there's a funding announcement, you can see how much money the program is getting, how many awardees they plan to give funding to. And sometimes you can, look at previous years for that as well. Sometimes you can even reach out to the program officers and just get a sense of, how competitive do they think this program is going to be this year? They probably won't give you that many details, but sometimes they can let you know, oh, we've been having a ton of conversations with a bunch of different groups interested in the funding, in your state. And sometimes they'll say, well, actually, conversations have been pretty light. And that gives you a sense of, oh, maybe this is a really good time to go after this. Not that many other people seem to be applying. And then when it comes to actually applying, again, a few tips. A lot of this is obvious, but it's just we've seen these things be deal breakers, so we just want to highlight them. So the guidelines are your friend. Read the guidelines, read them again and again. There's great information in there. Some guidelines are going to be more detailed than others. Reach out with questions early to the program administrators. Sometimes if they give you the opportunity to have, a conversation with them and talk through your project, that's a great thing to do. It's great to have these people just on your side and aware of your project. And again, they can give you feedback, hopefully early, if you need to make adjustments. If you're looking to hire a grant writer, also something you really want to do early, or an evaluator. So some grants are going to require evaluation after you're awarded to basically make sure that your project is meeting the goals that you had outlined in your application. Hire those people early. A lot of times grant writers and evaluators focus on specific programs. So if a program's coming up, that writer's probably getting busy. So, try to hire them early. But again, if you're looking more internally for writers or a writing team, also try to find those people early. And again, it might be a team of people for grants, because you might, depending on what you're doing, you might have to have the big picture person, the person who's going to talk about, the people that you're going to hire. If there's technology in your budget, maybe your IT director for explaining how the technology fits into your project. So a lot of pieces and a lot of people you'll probably have involved. I have this highlighted here, and we're going to touch on it again. Your SAM registration. So if you're looking to apply for federal funding, you will probably need to have a SAM.gov registration. This is the System for Award Management, and this is actually required for the Rust DLT grant as well. This has been a deal breaker for so many projects. I don't even want to count, but basically, these registrations can take a little bit of time. They've gotten a lot faster in the last year or two, but I would still give this a few weeks. So if you don't have a SAM registration, get going on that as soon as possible. If not for this grant, potentially for other federal grants, you want to make sure it's not expired, that it's up to date. And then also, always check where the application has to be submitted. That will be in the guidelines. A lot of applications get submitted in grants.gov, which is where the RUST-DLT grant will get submitted. And with grants.gov, you want to make sure that account is connected to the SAM registration that you're applying under. But other programs have different requirements. Some agencies have their own websites that you submit through. I've seen things even nowadays where you just email an application over to somebody. It just depends on the program. And no,
Vicky, I just have a quick
yeah.
question regarding the
Yeah.
SAM registration. I think that's very important since that will be a deal breaker if you don't have one. Number one question is how easy it is to register, and number two, if you have partnership with other institution or other organization, do you have to have just one SAM registration, or you have to have SAM registration for each of those partners?
Great question. So how easy it is you do have to have some paperwork in place to help you through that. So typically it's all stuff, your administrative office is going to have. It's just kind of getting organized on that and pulling it all in. But the actual process isn't too long. And as I said, the approval is usually, I've seen it be done even just in a few days, but again, I'd say give a couple weeks just to be safe about it. They also have a really excellent help desk. So if you're confused on anything, contact their help desks. It's one of the rare ones that I think is, really great. And then as far as does everybody need to have one, it depends on the program. I'll speak to the RUST-DLT specifically. So, and even with that, you can do it both ways. So if you're working with partners, you can either pick one that is going to be the lead applicant. They will serve as your fiscal agent, and they're doing everything. They're the ones providing the SAM registration, all the other paperwork. But then that entity is typically going to be the one that procures all the equipment for everybody. Versus you can have the opposite, where everybody is essentially contracting with the USDA. So everyone needs a SAM registration and then some other paperwork requirements as well. But then every entity is able to procure their own equipment. So it just depends on how you want to do it. It is a little easier, I think, just to pick one lead applicant, but it doesn't make sense for every type of project. So before I move on from that, just one, again, minor thing, but there's always a time. So not just the due date is important, the time is important. I think the RUST-DLT, it's like 11:59 Eastern on January 30th. So again, we've had projects miss it by just a couple of minutes. They don't care. That is a firm deadline. So just make sure you're aware of the exact time. Hopefully you're submitting it days before that, or at least hours before that, but definitely do note that that is an important piece. Okay, so getting into this grant specifically. Now, some of you might already be aware of this program. And again, I think if you're applying this year, hopefully you're already aware and kind of, going through a potential project. But for any of you who aren't aware, so the acronym RUST-DLT, or initialism, what it stands for is it's the Rural Utilities Service Distance Learning and Telemedicine Grant. So this is an annual technology-focused competitive grant program. It's been around in some form or another since 1994, so it's a very long-standing program, and one that is supposed to recur in the future. It's funded, I think, for the next couple of years, but one that our team really believes should likely continue to receive funding well into the future. What this program focuses on is interactive, real-time distance learning and telemedicine projects that give, as it says, rural residents access to critical content, critical services, things that are very hard to obtain in these, very isolated rural communities. And the hope is that we're going to, help bridge the digital divide through these projects. That interactive real-time piece is very, very critical. So when you're thinking about telehealth, for instance, the way this grant usually defines interactive is a video interaction, like this, or hopefully even better than this, with better cameras, with Zoom, with all kinds of features that let you have a really great telehealth consultation. A phone only, like a telephone conversation. So if you wanted to get a bunch of phones under the RUST-DLT grant, that's not going to count as live interactive telehealth for this specific program. I know we already touched on this, but this is a really great thing. One way this grant is very unique is almost any type of organization can apply. So when you're thinking about potential partners, I mean, the sky is basically the limit. There's only a few exceptions listed here. You can potentially work with anybody. A very unique program, not a ton of programs allow you to do that. And then also both formal and informal consortiums are eligible to apply. So basically, when you're getting your partnerships in place, you don't have to have anything super formal. If a group wants to work with you, let's say you're the lead applicant, and you have a few groups wanting to work with you, they just have to agree to be part of your project, and they should provide you with a letter of support, but nothing more formal than that. It could be, just a couple of paragraphs saying we want to be involved in such and such project, and this is why we're excited about this project. Jumping into some details. So for this year's program, it's a pretty large cycle. $64 million has been allocated to this current cycle. 12 million of that has been set aside for opioid use disorder and substance use disorder projects. And likely the program will actually get more funding this fiscal year, but what we've heard from the USDA is they're pretty unlikely to have another funding round. So what that means is they will likely, if they add money, they'll just fund more applications from this current cycle rather than opening up another application cycle. So that is interesting. And that's why one of the reasons, typically I would say less than 4 weeks for a RUS-DLT is, it makes me nervous, but I think with this year's program, it's going to be so big. If you can get an application in on time and you do it to completion, even if it's not the strongest application, I would say this year there's maybe still a chance that you receive funding, whereas maybe in other years, because there's usually less money to go around, you're a little bit less likely. There is a new requirement this year that I just want to touch on, depending on where the partnerships you all have are going to be. If you're a non-tribal organization, but you're looking to bring services to tribal land as part of your project, you have to get a tribal resolution from the relevant tribe or tribes that you're going to be working with. And that is something that can take a bit of time. It usually has to go through the tribe's tribal council, and most tribal councils don't meet very often. So that is a big that's required for eligibility. So I would say at this point, if this is something you're looking to do, but you haven't been in communication with the tribe, it's probably not going to be likely that you can get that resolution in time. I'm not saying it's impossible, it depends on the timing, but that's a bit of a sticking point. But if you are a tribe yourselves, like if you're looking to apply for the grant, you don't need that tribal resolution. You just proceed forth with the application.
Victoria, just to clarify, the tribal resolution is essentially the tribal council of the tribe that the services you're going to bring on had the approval that they're okay, with the projects that you're proposing.
And they have a sample of it in the RUS-DLT guidelines. So if you want to take a look at some sample language, it's like a formal piece of legislature. It's more formal than a support letter, for instance. So with tribes, there's this added requirement. I know I said you can work with everybody and you can just need a letter of support, but this is the one exception where you just need something a little bit beyond that. This is a 3-year grant. There is a match required. So with this grant, it's 15% of your grant request, which is about 13% of your total costs. And you can request between $50,000 all the way up to $1 million. So if you're doing $1 million grant request, for instance, that match would be $150,000. So your total project costs would be $1,150,000. And we'll get into the details of this, but a reminder, this grant is really technology focused. So we'll go through that in just a bit, sort of what can be covered, what can't. And then from a scoring perspective, we'll also go through the details of this in a moment, but the way you usually set up a project is you're connecting sites to one another to share resources. So you could either connect rural sites to one another. So if somebody has one kind of specialist and somebody has another one, and now you access one another through telemedicine, you have access to both of those specialists at both rural sites. Or another project is you have rural sites connecting to a hub, which is a service site, and the hub can be located anywhere. And oftentimes the hubs are actually going to be in larger metro areas because that's where a lot of resources and physicians and specialists tend to be is in those larger metro areas. That's going to work as well. The hub, oftentimes actually those hubs will be the applicants. You might have a large university or a large medical system applying for the grant, but they're partnering with schools or rural clinics, critical access hospitals, places that really need the resources.
Hey, could you just clarify a little bit about the matching? What do you mean by 15% match? Should there be a funding for that? And does federal grant matching is not, coming from a federal organization is not required, right? Just to clarify.
So the match, it basically means that the USDA will cover about 87% of your costs, and you have to supply the remaining 13 or so. The one requirement is the match cannot come from federal funds. So you can't use a federal grant to make up for that match, but you can use state funding, local funding, foundation funding, donations, all kinds of other things. And we do recommend including a cash match. They tend to prefer that. They take in-kind matches, but they prefer a cash match. So if possible to position a cash match in the project, that's what we would recommend.
Thank you for clarifying. And one more thing, sorry, I have so many questions. Regarding the funds should go, it's very clear to technology and, devices and whatnot. How about, you want to deliver telemedicine, but in the areas where you want to deliver telemedicine, especially in rural areas, this is reality or facts that they don't have broadband services. So can broadband services be part of those, of budget?
Yes, great question. And it takes us to our next slide around eligible and ineligible expenditures. So what this grant really focuses on is essentially video conferencing hardware and software that's going to enable this live interactive distance learning or telemedicine session. And then associated services, so installation, maintenance warranties, training on how to use the equipment. There is just a cap on that. Training can only be up to 10% of your total grant request. And another cap they have is up to 20% of the grant request can go towards broadband related expenses. So this is not a broadband focused grant. The USDA has other grant programs that focus on broadband. You can have some costs going towards broadband, but if you do the math, if you're asking for $1 million, that's only $200,000 that can go towards broadband. So probably kind of more of like the last mile fiber connection type of projects versus a really, broadband heavy project. But things like modems, routers, wireless access points to augment a signal in a building, something like that can work. We even see sometimes hotspots if you're doing patient services into a patient's home. Maybe a patient gets, a tablet device or a computer device and a hotspot included. That can be an option as well.
Can you tell me what remote instruction here means?
So this is basically, you can get certain types of remote instruction covered, but it all has to be live interactive video instruction. So if you need to invest in, like we have some, sometimes you want to hire a group to do like digital adoption type of training with people. Like if you want to hire somebody who's delivering services essentially as part of your project, you can get some of that covered, but the exceptions are kind of jumping to ineligible costs. You can't cover salaries of your personnel. So like if you're a university, you can't include a professor's cost, but if you're a university looking to hire some external company to do some type of instruction, you can potentially include that depending on how that instruction is set up. So you can't cover salaries of your own personnel essentially, and you also can't cover anything asynchronous. So this is again, live interactive distance learning and telemedicine. So if you're setting up some kind of, modules, static healthcare education, that's not going to be covered by this grant. And a few other, ineligible costs. It's a unique program. So no indirect costs, which is something, again, kind of rare with grants. There's no evaluation required with this grant. So this is actually pretty light on the implementation side, not too much required there. And then think of everything here as essentially provisionally eligible if you justify it correctly. So a computer is a great example. A computer can be used for a bunch of things besides distance learning and telemedicine. So if you put a computer in your budget, you have to make it clear that for most of the time, that computer will be used for the purposes you're listing in your project. We can't just have, computers being provided for general administrative purposes. It really has to be like, no, we need the provider to use this computer to have video consultations, with the patients that are located elsewhere, something like that. Now, I'm going to have to speed up a little bit if that's all right, just because we have a lot of content to get through. Okay, awesome. So these are all great questions, but I think a lot of this we're going to get through as we're going through the slides. So I'm just going to speed up a little bit. So as far as project design, these couple we've already talked about, but I just want to elaborate. So the hub and spoke model is the one where you're connecting to a service provider and you have all these different rural sites that are connecting and getting information from that service provider. And again, that hub can be located in a large metro area. And then the hub end user to hub end user basically means everyone's talking to everyone. So everyone's sending out services, but also receiving services. And for that to work, all of the sites have to be rural. And we'll get to what that means in just a moment, but keep that in mind. Now, there's another type of project design you can do. It's a little bit more rare, but I think with healthcare in particular, this question comes up a lot. So what if you want to provide services into a patient's home? Anything going into a patient's home or a student's home is, very similar example, that has to be set up as a non-fixed project, or potentially if you have both elements, so you have sites talking to one another and some sites reaching out to people in their homes, that would be a hybrid project of non-fixed and fixed elements. Fixed is what we talked about here. Non-fixed, basically what non-fixed means is, what it technically means is the technology on the receiving end is moving through an area. So think of it as, the patients you have probably won't be your patients forever. You'll probably take that technology back at some point and give it to another patient. Or for instance, if you wanted to have like a EMS services, emergency response services, in a van, a moving vehicle, and that's going to be going through an area, it's not going to be in any one designated spot necessarily. It's moving through a service area. When you have a project like that, all of the scoring is based on where the services originate. So it's the opposite of what I've been saying. What I've been saying before is the hub, where the services come from, doesn't matter for your scoring with the fixed project. With the non-fixed, your scoring is based on the hub. So basically what it means in simple terms, if you're doing services to a patient's home, the site where the services come from has to be rural. So you can't have a site in Dallas doing rural, directly talking to patients in their homes and surrounding rural areas. That's not going to work. But you can have a site out in a very rural community, critical access hospital, a clinic where probably their patients still live maybe an hour or more away. Those types of sites can do services to patients' homes under this grant. So I'm going to move on from that, but just again, in terms of who you can work with, the sky really is the limit. We just have some examples here, some popular examples of what we've seen over the years. A few of these are more healthcare focused, a few are more education focused. You can have one project that has both distance learning and telemedicine elements. We see a lot of, reaching out into rural clinics and maybe doing continued medical education with the staff, but also offering telemedicine services to their patients. There's, again, a lot you can do here. We've seen an increased focus on mental health services as well in recent years. And it could be very formal, telemedicine sessions, but even sort of more informal peer counseling type sessions or, group counseling sessions. All of that can totally work under this grant. It's pretty broad in how it defines both distance learning and telemedicine. As long as it's live and interactive, the formality, I guess, of it can vary quite a bit. So what we're going to jump to next is going through the key pieces of the application. And before we do that, I just like to show this to give you a sense of what goes into this application. But I don't want you to get too scared of this. So I know it's a lot of sections. a lot of this is going to be paperwork. Some of it can take time. Like for instance, here, you have to have your SAM registration included there. And, as we talked about, that can take a little bit of time to set up. But if you have that in place, great, done. We're good on that. The only parts that are scored, oh goodness, sorry, my mouse got too excited. The only parts that are scored are these parts in section D. So everything else is required but not scored. And some of these other parts will have narratives. So for instance, we'll get into this, but the telecommunication system plan, this is essentially a budget narrative. So you go through your budget items and you describe all of them and how they fit into your project. That's a narrative you have to include, but it is not scored. The only narrative that is scored is the needs and benefits narrative. And again, we'll go through the details of that shortly. And then the biggest piece, as you can tell just from these point breakdowns, is your objective score. And the objective score, you will know what that is for yourselves, before you even apply. You're probably thinking about that as you're putting your project together, as you're thinking about your partners, as you're thinking about which sites are going to be involved in your project. And again, we'll go through the details of this. So this is what we help a lot of groups with is, figuring out how to maximize their objective score, figuring out what's competitive for their general area. Because as you see, again, you can have the best narrative in the world, but that awesome narrative is probably not going to win you this alone. It's really about, trying to maximize these objective points. So let's get into that. So objective score, we always kind of think of it as, again, a numbers game. So when we meet with a group, we say, okay, what are your sites? What are the sites you're trying to bring services to? If there's any urban sites, I'm like, well, it would only make sense to include those if they're going to be service providers. And, we go through all of that. And essentially, we crunch the numbers, we see what the score is. And if it's not great, we try to rethink the partners. I mean, sometimes there's less flexibility in that, but, sometimes it's like, well, can we remove this one site? Or can we try to get this other site convinced because they will really bump up your scores? So that's a really key piece of this. Starting with rurality. So how do I determine rurality? It's all going to be in the guidance, but I just want to give you a quick run through of this. So this year's program is using, it's hard to believe, the 2010 census. So they're still using the 2010 census. We assume probably next year it's going to be the 2020, but never assume anything, always check the guidelines. So it's still going to be the 2010 for this population data. And how it works, you go to the census website, we link to it here, and I think we'll be providing a copy of this deck, I'm sure, afterwards. You look up the population data for place. So it's going to be city, town, or other census designated place, and you see if it's in the census. Some places aren't going to be in the census, especially, some very rural communities just aren't going to be in there. There might be unincorporated communities. Or what you might have happen is maybe there's a town that you're near. It might even be the town that's in your address. But if you look at it on a map, you're like 15 miles outside of that town. If you're really far removed from a town, or again, if you're not actually in the census, you are called census rural, which actually gets you the maximum rurality points. So that's a quick walkthrough of rurality. For the population lookup. Now, one key thing to keep in mind with rurality, and again, the guidance talks about this, but this can be a showstopper sometimes too. It's not just based on population data anymore. It used to be, but now what they also look at is the USDA developed a map that basically shows how close you are to large metro areas. So think of it as, there could be towns or cities that maybe have 6,000 people, but they're really close to a large metro area, or close enough by this definition. And if they are, they're not going to qualify as rural. They would get no points. And I have a really good example here. So there's this high school in Harvest, Alabama. Harvest, Alabama, the population is, right around 6,000. That counts as rural. It should be, a fairly competitive site. But if you look it up on this map, you see Sparkman High School's over here. And it's very close to Huntsville, Alabama. And Huntsville, Alabama is considered a large metro area by the USDA's definition. So this site doesn't count as rural. If it's in the yellow on this USDA map, it doesn't count as rural. It can still be involved as a service provider site, as a hub site in your project, but it can't be a site receiving services. That's rurality. I'm going to now move on to the next key piece of your objective score, economic need. Economic need is based on something called SAPE, which is small area income and poverty estimates. And there's also a tool where you can look this up on the census website. What you're going to look at here is a county-wide measure. So it's still going to be based on where your sites are located, but rather than looking at the town, city, census designated place, you're looking at the county where that site is located. And it's going to be a measure of the percentage of people who live in poverty in that county. And this year's program is using the 2020 SAPE data set. On the website, there's actually a 2021 data set available already, so make sure you're using 2020. And the USDA's website also has a file for the 2020 SAPE, so I just recommend using that. And just keep in mind, sometimes this is how it all boils down. So rurality, economic need, we'll talk about this last one in a sec. Both based on location, you know, the lower the population, the more competitive it is. It can't be over 20,000 or else it doesn't count as rural. And then economic need, same thing. The higher that state percentage, the more points you get. And you see it's kind of bucketed like this. So unfortunately, 10.1% is going to get the same score as 19.9%. It's just the way that they do it. They put you in a bucket. And then all of these are going to be averaged across all of your sites. So you find out the rurality score for each location, then you average it. That's your overall rurality score. Oh, goodness. And then same thing for the economic need. You're going to average it. So that's where it's, you know, really important to think about your partners. Some might drag your score down a little bit, but that could be okay if you have a bunch of other sites that are going to bump your score back up. And as far as what's competitive, in a typical year, we usually tell groups, try to get pretty close to the 40 and try to get at least 10 here. But keep in mind where you're at. So at least 10 is a pretty good measure across the board, but some states, like there's a lot of states in the West where you can't get more than 10 points. There's no counties with SAPE over 20, so this is the maximum they can get. And then there's other states where there's a lot of counties that would get 20 or 30 points. They do think about it's a federal grant, but they say in the guidelines, they can limit the number of awardees per state if they choose. So you want to be overall competitive, but you also kind of want to be competitive in your general state. So if you have a state where there's a lot of counties with SAPE over 30, I would say the 10 is probably not great. You want to maybe be at, you know, closer to the 20. However, this year's program, like I said, very, very large. There's a lot of money to go around. They're probably going to be even adding more money to this program and not having another application cycle. So this is the year where if you have a lower score, I would maybe still encourage you to go after it. If you're willing to put in the work and complete all the application requirements, this is the year where, yeah, all those iffy ones, I would say, maybe go ahead and proceed. I mean, I would still say 20 to 30, 30 here would be good. What I've been recommending is 40 overall. So this last bit we haven't talked about. Special considerations are extra points that you get if you meet one of the focus areas for the grant this year. And there's a few focus areas. These are all location based, and you can look at that USDA map to determine if any of your sites meet these requirements. And then these are more programmatic. So if it's a distance learning project where you're supporting Native American languages, or if you're doing a project where the main focus is mental health services, you can potentially claim one of those 2 points. So I would say at least 40 overall, and they can really come from anywhere for this year's program. But I've told groups, like I have some groups I've worked with where, you know, they have 35 points, and I basically tell them the same thing of, this might be your year. I would say in a normal year, that's not great, but this year, again, with all the funding that's available, if you have the time to put an application together, I think you should go for it. Okay, I'll pause there for questions. I'm going to get into the subjective scoring. So this is talking about your narrative, and then there's still a few other application sections I just want to briefly touch on. But any questions, and I'll check the chat as well. Any questions on the objective scoring?
Quick question, Vicky. Texas is a big state with a lot of border states. Does this need to be just within Texas, or could we do some project wherein it involves New Mexico, which is very rural as well, especially Eastern New Mexico or Louisiana or Oklahoma?
Totally. So you can have projects across states. That's not going to be a problem. And there's actually quite a few. If you look at previous winners, there's always a few every year that include a few states where there's just natural collaboration. You will, though, want to get that. There's one section of the application where you get a letter from the USDA state director for your state. I think you would probably have to get the letter from all relevant states. It shouldn't be so hard. You just kind of email a project description to all those state directors and ask for a letter. But yeah, no, totally, you can have projects across as many states as you see fit. You have to include a map of all of your sites in one of the sections, but you can have a few different maps if the zooming doesn't make sense. Sorry, that was my mouse again, but let me know if there's any other questions before I dive into this. Awesome. Okay, I'm going to move into this. So this is, again, the only scored narrative that you have in this grant. We recommend starting on this early. So just to give you a sense of this, the projects that I've been supporting, I would say some of them already started on this, but a lot of them are kind of at that point now in the process where they're starting to work on this narrative. And I mean, they still have a lot of other things to do, but again, I recommend working on it early, brainstorm on it early. You'll probably have to go through, a few iterations of this, and you want to pull in data for this as well. It can be any data that speaks to your points. You can use anecdotal information too, but you want to try to back up what you're talking about. Basically, the point of this section, this is what you have in a lot of grants. They just might call it something different, but you're describing the community needs and you're describing how your project is going to meet those needs. And, anything that shows that need is going to be great to highlight here. And think of it, for instance, that economic need score we were just talking about, that SAFE. That is what determines your objective score, but obviously there's so many ways to determine economic need. If there are other measures where your communities, score, I guess, high, where that demonstrate need, all of that is going to be great to pull in here. If you have multiple special consideration categories that you fit, so maybe you're doing mental health services, but you're also bringing services to tribal lands, also to farm worker communities. For the objective points, you have to just pick one. For your narrative, you can talk about it all. The more, the better. The more need you can showcase here, the more likely you are to get funded. What you usually start with here is community involvement. So again, this could be relevant to a lot of other grant programs. And you want to talk about this in your application. You want to tell them, this is how we landed on what we're doing. We didn't just make this up. We know there's a need for this. A lot of ways you can do this. You can hold planning meetings. You can post something in the newspaper, post something on social media, trying to get, input from the community. You can send out a survey to individuals, but also to partners, to other, service providers. Have planning committees, meet with your board. A lot of ways to show that you're gathering input from various people to try to figure out what you're doing here. And again, put that actually in your application in some capacity. I mean, screenshots are always great. Like, we had this meeting, or, we posted this on our social media. Whatever is going to show that you did something here is great to put in there. And then once you do that need assessment, what that is going to lead to is identification of the needs and really figuring out your project. So when you're thinking about the needs that you're going to talk about, we always encourage you to think broadly at first. And, you might jot down a list of like, 10 different needs. And then, kind of think through, some of them might overlap and that, maybe you can kind of work them in together. And then some of those needs might sort of expand into other uses. So what we have here, for instance, is maybe there's a need to provide primary care in a school-based health setting. So school-based health, maybe there's a need for that in your community. Great way to, reach students and just reach the broader community as well. But that can have a bunch of other benefits too, and meet a bunch of other needs as we have listed here. Once you kind of open that up and you put this technology in there and you kind of have that communication road going. There's a lot that you can do with it. And what you're going to really be doing in this needs and benefits narrative, and we actually recommend putting this in here, is usually you have a table, you identify a few needs. We recommend at least 3 needs. And the needs, again, are usually going to be very broad. You identify benefits that your project will bring and you tie them to the specific needs. And you want to list some outcomes too. Outcomes are usually, they're going to be more detailed and usually have some kind of numbers or metrics in there. But keep in mind, again, there's no evaluation required with this grant, so you don't have to prove each of these outcomes. Be reasonable about them though, and use your best guess for how many people you might reach, what effects this might have on the community. But again, they're not going to hold you to like, oh, you said it would be this number of patients, but it's this number of patients, or it's just do the best that you can here. And then you basically talk about all those. So the bulk of this narrative is go through essentially what you put in this table and talk about the needs. So there's a lack of local primary care. What does that look like? Where is the closest physician? How busy is that physician? How many people haven't seen a physician in the last year or two? Any stats that you can pull around really demonstrating that need is going to really be the bulk of this section. And I already, I guess, started talking about all this, but yeah, you really fill in the details. You cite sources, but again, you're really free to use whatever, kind of reasonable, dependable sources you all could find. It's not really specific on what kind of data you can pull in here, really anything that proves your point. Anecdotal information is great as well. If you want to get some interviews with community members, just quotes on challenges they've faced, that's really great to put in there. And I think we said this earlier, but you want to be a storyteller here and really talk about all the things of, it's a 30-minute drive to get a gallon of milk, all the struggles that you have. It's like, oh, there's a mountain that prevents me from getting to my primary care physician as often as I would like. Like all of those things are so great to put in here. A good point here is, I know it's a distance learning and telemedicine grant, but never assume that the reviewer knows a ton about your specific topic. They probably won't have, medical expertise, for instance. They work at the USDA Rural Utility Service. They look at this grant program, but they're not going to have that type of knowledge. So try to keep, the language fairly approachable. I mean, I would have somebody read this who isn't in healthcare and say, hey, does this make sense to you? Does this project make sense? Do you get what I'm trying to do here? Limit the jargon that's specific to your world and just kind of make it applicable to the average person. And then a few quick things I just want to say. So the needs and benefits narrative, the bulk is what we just went through, but there's a few other pieces you want to touch on here. This we've already kind of been talking about. Again, talk about the challenges, the demographics, the geography in your community, the support that you received. So you want to talk about that community involvement piece on how you landed on your project and your needs. And then you also want to get a bunch of letters of support. There's no limit. How do I say this? Quantity is great, but quality is also important. So you want to get a bunch, but don't make them all look exactly the same. They're going to stop reading those after a certain point. The best letters come from the heart. We've had people, we've had little kids draw pictures before, and we've included those as letters of support. I mean, anything that, again, is just going to be genuine and authentic. And then you just want to talk about if this aligns with any other initiatives in your state, if there's a particular telehealth focus in your state or anything like that, you can cite similar initiatives and just talk about how this fits into the larger state plan. And a really, really key piece, and you'll have to actually talk about this in a couple other sections in your application. If you've ever been involved in another RUS DLT grant, they don't specify how far back. To be safe, I would maybe go back 2015, 2016. If you were involved either as the awardee, so you received the grant, or you were involved as a project site, or any of your sites were involved as project sites, you want to talk about that. If they see duplication, they will assume you're duplicating the project and kick you out. they want to make sure you're not doing the same thing that was just done or getting the same technology for the same uses as, last year. And you're probably not. So, but be explicit and be very clear about it. So if there was another project that was for medical education, but now you're doing the telemedicine piece, talk about that. If you did physical health and now you're doing mental health, talk about that. If you're including new sites, so it's like, yes, we won this funding, but it was for these 3 communities, and now we have 10 other communities we're working with. Perfect. Just make it super, super clear. And the last piece, just to go through real quickly, again, there's a lot of application sections here, but these are, I would say, the biggest of the non-scored sections, and just a few. I just want to describe them and just give you a few little tips on how to tackle them. So your budget and your telecommunications system plan. There's a budget worksheet. Typically, you're just gonna copy and paste from your quotes essentially, and go location by location. That's how they want that organized. So you break down all of your budget costs by location. And then this is the bulk of this is a budget narrative where you're explaining all of those costs. So the budget worksheet, you actually attach it in section F, which is scope of work. Again, the guidelines will let you know about this. There's a few other things you have to put in that section too, but just focusing on the budget. You do have to have the technology scoped out to apply for this grant. So again, you want to attach vendor quotes and you want to list specific technologies in the budget, but like I say here, sort of specific, but not too specific. So you don't have to get like part number specific necessarily, but you want to say, such and such laptop computer. You want to say, such and such telemedicine cart valued at X amount, and we want this number of quantities. And again, you include a vendor quote that justifies your prices. You are not tied to that vendor. That will come later. When you do if you were awarded, the procurement process is later. For now, it's just basically letting them know the dollar amounts and the types of things that you want. You do want to try to stick to the specific technologies if possible, because there's a process if you're trying to change things. So like if you're going from a cart-based system to now a wall-mounted system, that's a bit of a change, and they might require that you submit another budget later on. They'll probably approve that change, but it's just a little bit of extra paperwork. So you want to try to stick to it, but I'm just saying, like, whatever vendor you're buying that from, you're not necessarily tied to the one that provided you with that quote. Unless that's the one you end up choosing after you go through your procurement process and follow your policies. And again, separate everything by site, including installation costs, warranties, shipping, and taxes. We've had things get kicked out if they're not separated by site sometimes. Some vendors might lump that across all your sites. Just divide it out. It's fine if the quote has it all lumped together, but just make sure that your numbers make sense when you break it out by site. And then this telecommunication system plan, as I said, essentially the bulk of this is a budget narrative, line by line explanation of all of your budget items. And there's a few other things you have to put in here. Make sure that you look at the guidelines for that. But I know that the name of it sounds a little funny, but that, again, more or less, just keep in mind, this is a budget narrative. You'll probably want maybe a more technical person involved here, if it makes sense, an IT director or somebody like that. But you don't have to get too technical. Again, like I said, it's like, oh, well, this is a telemedicine cart with such and such peripherals. We're going to be using it for, these types of consultations. It will be used. A key thing is you have to say the percentage of time it will be used for distance learning and or telemedicine. So it will be used 100% for the telemedicine purposes outlined in this project. We talked about this, but there's a limit, remember, to training costs and broadband costs, the 10% and the 20%. If you have those costs in your budget, call it out in both this section F narrative and the section I narrative, and just say, like, these are our total training costs and they make up 7.5% of our budget. Make it super clear, just so they don't kick anything out. And again, don't lump training and installation, because that will probably maybe take you over that 10%. and then they'll kick out that whole line item. So you get training and installation kicked out, which is going to be a problem for your project. So try to divide things up. That way, if they do challenge something, they're just kicking out that specific thing and they're not kicking out, like an entire system or an entire service. And I know we're at time. Can I go, if it makes sense, maybe just for like 1 or 2 more minutes, and I can stick around for some questions too. But if anybody has to hop, thank you for joining us. I know this was a ton of information, but we appreciate it, and we're going to make the deck available. And if you have any questions, please reach out. But other noteworthy paperwork requirements, again, the SAM registration, I know we talked about that quite a bit. One key thing with the SAM, and the guidance will have good guidance on this and a screenshot on this. You want to make sure the financial assistance representations and certifications have been made in your SAM account. This is easy to do if you have a SAM registration. The admin person logs in and they change one answer from no to yes. So it's an easy switch, but make sure you understand what that is, and you want to attach that report in your application. The tribal resolution, the tribal government resolution of consent, which we talked about, you want to, again, you have to get that as a non-tribal applicant, even if you're not going for those tribal land special consideration points. If you have any tribal sites, this is a requirement for eligibility. So you want to attach it in section N, which is supplemental information. And if you're trying to get those tribal land special consideration points, you attach it where you include your special consideration worksheet, which is in section D. For legal existence, your SAM registration is not enough to show legal existence. It's very funny. You have to prove that you legally exist and can contract with the federal government. The guidelines lists a few ways you can do this. The easiest way, though, is to just reach out to your attorney, if you hopefully have one on, available on retainer, and ask them to put together a letter that basically speaks to your legal existence. That, there's some language, legalese, but more or less it's like, well, to the best of my knowledge, this entity exists. This entity can contract with the federal government. That's what that letter is. Again, kind of the simplest way to meet that requirement. And we also mentioned this, but the consultation with the USDA state director, most of the time, the state directors will get you these letters pretty quickly, but please don't save this until the end. Sometimes this can take a couple of weeks. Someone might go on vacation, you just never know. When you reach out to the state director, it says in the guidelines, attach your executive summary. You don't have to attach the actual one you're going to include in your application. Just include a brief project overview, maybe a page and a half. What's your project about? Is it fixed? Is it non-fixed? List out your sites. If a site drops or gets added between when you get that letter and when you apply, that's not a big deal. And give them a sense of your rough budget. You don't have to have the itemized budget at this point, but like, we're requesting $400,000 with this amount in match. And that meets that requirement. And those are really, again, kind of the main elements. There's other things. Go through the guidelines. The guidelines are pretty good, but again, there's some little tips in there that they don't always provide. Like I said, let us know if there's any questions. We can do a little bit of a Q&A, but this is just our team's general email address. And if you want to just reach out, we do a lot with this grant. We're happy to help answer any questions you might have, and just wish you the best of luck with this application cycle. I know the deadline's coming up, but again, keep in mind, this is a recurring grant, always something. I mean, we have groups right after that, the cycle closes. Like come February, if you want, you can start planning a project for the next cycle. Probably won't come out until 2024, but you can just get the ball rolling, get your partnerships in place, and just try to figure out what you would want to do.
Victoria, that is a very excellent presentation. Thank you very much for giving us this time and opportunity. And there's a question from Dr. Chemit Tiganti regarding the presentation. We will email you the presentation, and the recording of this webinar will be available as well in our website at texla.org. Quick question though, Vicky. there is some portion of, distance learning education here at the same time service as well. Is there a certain percentage that we should be doing education or distance learning, or, it could be just service, or, how much percentage is required?
So you can do just distance learning, just telemedicine, or a combination of both. And if it's both, it doesn't have to be 50-50. You can definitely have one of them be more of a focus. The only thing is, like for the mental health services, if you're trying to claim those special consideration points, that does have to be the primary focus of your project. So more than 50% of your project has to be around mental health services. But beyond, just to have a project more generally, if you're not trying to get those points, it can really be, however you like.
And this project, though, it should be a 3-year, when I read on the requirement, it should be a 3-year program, right? So is it the budget we're requesting is per annum or for the entire project?
Great question. So that the amount you're requesting is going to be total for the 3 years. So it's not like $1 million per year. It's a total, but it's your choice how you implement. So in that section F scope of work, you want to include a table, essentially a timeline. Again, rough, you don't have to stick to it, but do your best with it, of how you're going to implement. And some groups want to implement right away. And again, implementing for this project, the biggest pieces are getting the equipment, getting it to these rural sites and starting to use it for the purposes you outlined. Some groups get going on that right away. If you're just working with your locations, it's easier to implement usually right away versus when you have a lot of partner sites. But some groups implement very slowly. They might start in one county, then they move to another county. All totally up to you, but you do, you have that 3 years. Do it as you see fit. I guess just a couple things to think about. Budget wise, equipment might more likely to change as you get further out into the future. So you might have to do like a budget modification or change request is what we call them, where you put together that like new budget. It's a bit of a process. The USDA has to approve that before you proceed in purchasing. And prices might increase or decrease potentially. But I think the thing we've been seeing the last year or two, a lot of price increases. So think about that when you put your budget together. I mean, I would say like when you're working with your vendors for the budget, don't ask for discounts. Give them ask them like, hey, what do you think this will realistically be in a year and a half? Because another thing too is not just the 3-year period. What they said in the guidelines is they won't announce the awardees until September 30th of this year. I will say that is quite long. Usually the program announces awardees after 4 to 6 months. Maybe it's because they might add more money and announce all the winners at once. Who knows? Or maybe they just have a lot of programs this year. But it is, it's a bit of time before you hear back on this. So this is, a very long-term thing. You want to be thinking about, kind of the technology again that you're going to be using a year from now to, maybe 4 years from now, essentially.
All right. Any other question, Dr. George, or anyone in the audience? Any other questions?
Can a nonprofit organization pair with a profit organization? And how do we do that entity? I mean, like, how do you work on that?
Totally, you could. And you just pick which organization would be the applicant, and you can potentially have both of you contracting with the U.S. With the government, but then you would each need a SAM registration. But for-profit organizations can get SAM registrations as well.
And this can be also for individual purposes too, right?
Describe what you mean by that.
When you say, can an individual, if he's not part of an organization, can he or she apply?
That's actually one of the only no's. So sole proprietors cannot apply for this grant. It has to be, an entity, a for-profit company, a nonprofit organization, but not an individual.
So it's per organization. Yeah, that's actually a question by Dr. Chemicanti as well.
Awesome.
Okay. All right. Well, if we don't have any, go ahead, Dr. Chemitiganti.
So, Ariel, how are we doing institutional projects, campus-wide projects? What are we doing?
Go ahead, Vicky.
Well, I guess what is your campus? What is your where are you located? Are you in a urban area or a rural area?
So we are in Permian Basin, Midland and Odessa.
I think majority of the Permian Basin and Odessa region, check again the U.S. Census 2010, but I think they are all rural areas, Doctor.
Thank you.
If sites are rural, there's a lot more you can put at them, technology-wise, if that makes sense. If a site isn't rural, and again, you're going to use that technology to send services out to rural sites, you are limited, like you can only justify so much. Like a popular example might be like, if you're at a large hospital, you can't say like, oh, we need a system for every room if you're only working with 3 rural clinics. That just, the numbers just don't add up in that example, where you can't say that all that equipment will only be used for the purposes that, you know, we're listing in this project. So you can only equip a hub to the extent that it, you know, it's providing services to the end user sites. And the more end user sites you have and the more services, the more equipment you can justify at a hub location.
Vicky, that came out because, you know, Texas Tech had so many campuses. We have campuses in Dallas, but, you know, the main campus is here in Lubbock, but we have one in Permian Basin as well. We have one in El Paso, which is an urban area. We have one in Amarillo as well. So we are kind of unique entity as well.
Yeah. No, and that's a really great example. You know, we have a lot of colleges just more generally applying for this. So with colleges, you can potentially reach your satellite campuses if those campuses are rural. So you can have like a main campus or multiple main campuses to multiple satellite campuses. Or, you know, you can have the sites talking to rural entities. But again, the trick is like under this grant, at least, other grants are different, but you can't connect, you know, Dallas and Austin, for instance, because neither one of those is rural. You can connect Dallas to rural and Austin to rural, but if that makes sense. So you can't share courses between those two or share resources between those two.
And, you know, somebody correct me if I'm wrong, but Lubbock actually is kind of unique. There's part of Lubbock that is rural and there's part of Lubbock that is urban, actually.
Interesting.
Yeah.
And it'll be really good that places like that, again, even if the population numbers are over the 20,000, check out that USDA map. If you're not in the yellow, and potentially if you're quite far outside of town or city limits, you might also want to look at Google Maps for that because they have a really good kind of delineation of town city limits. You can potentially argue that that site is rural because it's so far, you know, outside of the city. Just the way this is really in the weeds, but what the guidance says is if that happens, let's say a town has population 17,000, where it counts as rural in this grant anyway, but you just don't get a ton of points. You would only get 20 points for that. If you're way outside that town, you can be census rural, which gets you 40 points. But if the same thing is true of a big town, a big city, again, something like Dallas, where you're way outside of Dallas, but let's say you have a Dallas address, but if you look at it on a map, you're like, okay, we are clearly like far outside of it. You could only get up to 20 points for that site. They count you as the mid-rural tier rather than census rural, because basically they're still saying, well, you have an address that's associated with one of these big metro areas, so we won't give you the full rurality points, but we'll give you some where you can still count as a rural site and you can still receive services. That's really, if you have something like that, reach out to our team. We can help you through that. That's rare and, you know, very, very intricate.
Again, thank you very much, Vicky. And before we let you go, thank you. We actually are, you know, in overtime, but we would like to present this virtual, you know, challenge coin. We will mail that to you to thank you for all the help and pointers that you gave us today. And thank you very much again. And hopefully we could invite you again in another presentation in the future, you know, because this is a recurrent thing. And on February 2, 2023, we're planning to do a telecardiology Project Echo webinar as well. Thank you again, Vicky. Thank you, Dr. George, Max, Nino, Laura, and Conrado.
Yes.
Yeah. Have a good one.
Thank you so much. Thank you for having me.